Let's get started. Start with listening, and then learn new words and practice them in sentences.
Did you know that your oral health can mirror your overall health? Indeed, the state of your mouth, teeth, and gums can often serve as a revealing window into your body's broader condition. For instance, chronic oral infections are known to be linked with diabetes, heart disease, and even stroke. This intimate connection highlights why dentistry is not just about maintaining a sparkling smile, but is crucial for overall health management. In the United States, dental care is recognized as a vital component of general health care. With a robust network of dental practices spread across the country, Americans have relatively broad access to various dental services. These range from preventive measures like regular cleanings and fluoride treatments to more complex procedures such as root canals and orthodontics. This comprehensive approach ensures that dental issues which might hint at other health problems are addressed promptly. Understanding this connection underscores the importance of regular dental visits. When stepping into a dental clinic in the U.S., what can one expect? Firstly, one of the most fundamental procedures is a dental cleaning or prophylaxis. This routine treatment involves the removal of plaque and tartar that have accumulated on the teeth, which, if left untreated, can lead to periodontal disease. Dental hygienists meticulously clean each tooth, polish them to remove surface stains, and offer tailored advice on oral hygiene practices. Moving on, fillings are another common procedure intended to restore teeth damaged by decay. A dentist will first remove the decayed material, clean the affected area, and then fill the cavity with materials such as composite resin or amalgam. This not only restores the tooth's integrity, but also prevents further decay. Root canals or endodontic therapy are performed when the nerve of a tooth becomes infected or the pulp is damaged. This procedure is often thought of with a shudder, but with modern techniques, it's typically painless. The process involves removing the infected tissue, cleaning and disinfecting the inner aspects of the tooth, and finally filling and sealing it. The primary goal is to save the tooth and alleviate pain. Orthodontic treatments also play a crucial role in dental health. They are not merely for aesthetic appeal, but are essential for correcting irregularities in the alignment of teeth and jaw. Braces, one of the most recognized forms of orthodontic devices, apply continuous pressure over time to move teeth into the desired position. This can enhance both the functionality and appearance of one's teeth, leading to improved chewing and a more balanced facial profile. Each of these procedures underscores the importance of preventive care. Regular visits to the dentist for cleanings and checkups can prevent the progression of oral diseases and avoid the need for more complex treatments. Moreover, they contribute to the overall well-being by preventing diseases that might affect other parts of the body. Each procedure not only enhances oral health, but also contributes to preventing future complications. How do Americans manage the financial burden of dental care? In the United States, the cost of dental care can be a significant concern for many. To mitigate these expenses, a majority of Americans rely on dental insurance. This coverage can be procured through private companies or provided by employers. Private insurance often covers routine procedures such as cleanings, fillings, and sometimes even more complex treatments like root canals or orthodontic work. However, the extent of coverage can vary wildly, leaving some with substantial out-of-pocket costs. On the other hand, government programs like Medicaid offer dental insurance for eligible low-income individuals and families. Yet, the scope of what Medicaid covers can differ from state to state. In some places, it might cover the full spectrum of dental services, while in others, it's limited to emergency dental care only. This patchwork coverage significantly influences accessibility to comprehensive dental care across different regions. For those without insurance or adequate coverage, dental practices often offer payment plans. These plans allow patients to pay for their treatments over time, which can make expensive procedures more manageable financially. Additionally, some clinics offer a sliding scale fee structure, which adjusts the cost based on the patient's ability to pay. Understanding the options available and making informed decisions about dental insurance and payment plans is essential. For many, this knowledge can mean the difference between neglecting oral health and receiving necessary dental care. Navigating these financial waters is crucial for accessing necessary dental treatments. What ethical dilemmas do dental professionals face in their practice? In the realm of dental care, ethical considerations are not merely footnotes, they are central to every decision and interaction. At the heart of these ethical quandaries is patient autonomy, a principle that underscores the importance of respecting a patient's right to make informed choices about their own health care. Patient autonomy hinges on the concept of informed consent, which is a critical aspect of dental ethics. This means that dental professionals must ensure that patients are fully informed about their treatment options, including the potential risks and benefits, and that they understand this information well enough to make a decision. This process must occur without coercion, respecting the patient's capacity to decide independently. However, the challenge arises when patients' desires conflict with professional judgment. For instance, consider a scenario where a patient insists on an unnecessary procedure for aesthetic reasons, which the dentist believes may compromise dental health. Here, the dentist must navigate between respecting the patient's autonomy and adhering to professional ethical standards that prioritize health over aesthetics. Professional ethics in dentistry also encompass a broader commitment to do no harm, provide the best possible care, and maintain patient confidentiality. These principles guide dentists in their practice and help build trust with their patients. The interplay of these ethical issues not only influences the trust patients place in their dental care providers, but also impacts the overall quality of care. By steadfastly adhering to ethical principles, dental professionals safeguard their integrity and the well-being of those they serve. Ethical practice forms the backbone of trust and integrity in dental care. How does the American view of dental health compare with other cultures around the world? In the United States, dental care is often seen as a critical component of overall health, a belief that is deeply ingrained in the national psyche. This perspective is bolstered by a robust educational system that emphasizes the importance of oral hygiene from a young age. Americans are routinely taught that regular dental checkups are essential for maintaining not just oral health, but overall wellness. Contrast this with other parts of the world where dental care may be viewed more as a luxury than a necessity. In some cultures, routine visits to the dentist are reserved for the affluent, while in others, traditional remedies and preventive measures take precedence over professional dental care. These differing cultural attitudes can significantly influence the types of dental services sought and the importance placed on oral health. In America, the emphasis on aesthetic outcomes, such as straight white teeth, also reflects broader cultural values of success and image, further underscoring the social importance of dental care. Cultural influences shape the approach to dental care, reflecting broader values and health practices. Today, we've journeyed through the intricate world of dental care in the United States. We began by understanding the profound link between oral health and overall well-being, establishing that maintaining a healthy mouth is integral to sustaining general health. We explored various dental procedures, from routine cleanings to more complex treatments like root canals and orthodontics, shedding light on what patients might expect when they sit in the dentist's chair. Our exploration delved into the financial aspects, highlighting the diverse strategies for managing the costs of dental care, from private insurance to government programs like Medicaid. We also navigated the ethical landscape, discussing the principles of patient autonomy and informed consent, which are pivotal in fostering trust and integrity in dental practices. Furthermore, we reflected on how cultural perceptions of dental care vary and influence practices and patient experiences, both in the United States and globally. With this knowledge, one appreciates the complexity and significance of dental health care, paving the way for informed decisions and better health outcomes.
Let's learn new words and practice English with the topic, Navigating Dental Care in the United States at a 2 level. Dentistry. Dentistry, the branch of medicine concerned with the diagnosis, prevention, and treatment of diseases and conditions of the oral cavity. Example, dentistry is essential for maintaining overall health, as oral diseases can affect other parts of the body. Orthodontics. Orthodontics, a specialty of dentistry that deals with the diagnosis, prevention, and correction of malpositioned teeth and jaws. Example, orthodontics is not just about straightening teeth for aesthetic reasons, it also helps improve oral function. Periodontics. Periodontics, the specialty of dentistry that focuses on the structures supporting the teeth, including gums and bone, and the diseases and conditions that affect them. Example, regular visits to a periodontist can prevent serious conditions such as gum disease, which can lead to tooth loss. Prosthodontics. Prosthodontics, the area of dentistry that focuses on dental prostheses. It involves the design, manufacture, and fitting of artificial replacements for teeth and other parts of the mouth. Example, prosthodontics can greatly improve the quality of life for individuals who have lost teeth due to injury or disease. Endodontics. Endodontics, the dental specialty concerned with the study and treatment of the dental pulp, root, and surrounding tissues and the prevention of related diseases and injuries. Example, root canal therapy, a common endodontic procedure, is necessary when the dental pulp becomes inflamed or infected.